Hi, I'm Sam Preece. I'm from Dallas, Texas. I'm a children's dentist there. I went to Texas A&M, graduated in 1999 from there, and then Baylor College of Dentistry for 4 years, graduated in 2003, and I've been practicing dentistry with children in Dallas for, I guess, the last 12 years.
So why did you decide to pursue the health field and why dentistry?
You know, I felt like I always wanted to be in some sort of health profession, whether I knew it or not. I never knew what. As I was growing up, when people ask all kids, what do you want to be when you grow up? I never really had an answer, or at least a specific one. But I tell people these days that I feel like I've been a dentist since I was 6 years old. As my first tooth got loose, I was real afraid to touch it. I was real afraid to eat. And I remember my father saying, well, take it out, you know. It's got to come out so your next tooth can come in. Just take it out, pull it out yourself. And I wouldn't do it. And I finally, eventually, probably weeks went by of this tooth dangling in my mouth, and I finally got up the courage to take it out myself and figured out how to pop it out. And I was real proud of myself. And as I got older, more and more teeth lost. There's like 20 opportunities for that to happen. And as I grew older from that age, from like 6 until maybe 10, losing all of my baby teeth, I would figure out the proper way to get it out myself. And it was like a hobby to me. It would be like every time I got a loose tooth, I'd be excited. I'd be like, okay, I'm going to go and get this tooth out for myself. And I think I probably learned more in those few years than ever how to take out a tooth. And when I was about 12, and was a pro at it by then, obviously, I was with one of my cousins, and same thing, he had a loose tooth and was hurting him, and he didn't know or want to take it out himself, and so stepped up and volunteered to do it myself for him. And I think I made about $10 from that and took it out for him. And after that, my family said, well, you know, why don't you be a dentist? And I thought, I'm already doing it anyway. I just made $10 on it, so why not? And so from then on, I said that was what I would tell everybody. I was going to be a dentist, and I never did say much else other than that. Maybe I was going to do orthodontics at some point, but from then on, I just geared everything towards focusing on trying to be a dentist when I grew up.
What was your major in college and how has that helped you in your career today?
Well, I actually majored in mathematics in college. A lot of my friends from dental school went the route of biomedical sciences, biology, things like that. But I was real interested in math growing up, elementary, junior high, high school. And I wanted to learn more math. And I knew I wasn't going to get that in dental school. I was going to get everything that I needed to learn how to be a dentist in dental school, but I wasn't going to learn anything about it in college, and I wanted to focus on something that I enjoyed. So I chose math. I always tell people, you will use math in your career, period. You will use biology in your career, for that matter. I use math on a daily basis, and I'm really good with numbers. So for instance, it's by being so good with numbers, it's helped me in my job. And for instance, I know tricks to calculate something a little bit quicker. In a stressful situation, I can think a little bit quicker on my toes.
What aspects of biology do you see in your everyday routine?
I think most of my biology that I would use in my daily routine would be related to the much feared cavity with children, and preventing cavities, most importantly, and then when they do happen, trying to correct them.
What exactly is a cavity?
A cavity is just like what it sounds. It's just a hole in the tooth, can range from small to large, that causes the breakdown of the tooth in general.
How does a cavity form?
It's actually a very complex process. We start with our tooth, which when it comes in, it's nice and clean. But pretty soon after, it gets covered in plaque from anything that we eat or drink. Plaque is just a little substance that sits on our tooth that is a breakdown of the food and drinks that we consume. We have a lot of bacteria in our mouth. Some of it's good and some of it's bad. We obtain a lot of the bad bacteria from our mothers, our fathers even, that have had passed on from their parents. The bad bacteria that we have in our mouth attaches to this plaque that we have on our teeth and uses that as its house. Bacteria feeds on the sugars that we consume. And the byproduct of bacteria and sugars is acid. Acid is really bad for our teeth. It lowers the pH in our mouths, which lowers the pH of the surface of the tooth, and acid and the enamel of our teeth don't interact very well. When the acidity in our mouth goes up, we have several ways to counteract that. One, we have saliva in our mouth constantly being developed and secreted from our glands that can counteract the acidity, try to bring up that level so that the pH in our mouths is not so dangerous. It's dangerous because the acid attacks the enamel and weakens the enamel over time. So we have several methods of counteracting that acid attack, that pH decrease. One, our body tries to do it itself by creating saliva. Other ways that we try to do it: brushing, flossing, mouthwash, our normal oral hygiene techniques. If one or all of those things are missing, then we have that acid attack on the enamel, and at a certain point we can no longer combat that. The enamel gives up. It can't fight that anymore, and it starts the process, or continues the process, of creating a cavity in the tooth, where the enamel begins to completely break down, make a hole in the tooth, and that bacteria and that hole grows all the way into the tooth and creates a very fast cycle of destroying the tooth.
How do you fix a cavity?
Well, once a cavity has been formed, we definitely need to go in there and do something about it, because it will continue to grow and grow and grow until it destroys the tooth. We start by just trying to fill the cavity, which is basically where we go in there and we'll remove the damaged portion of the tooth, the affected portion of the tooth by the bacteria and the decay process, and then fill that in with a filling to try to resemble the shape and size of the natural tooth. There are several ways of doing that. We have a very tried and true, one of the original fillings, a silver filling. It's a metal-based filling, and has worked for centuries. I think I still have some in my mouth as well that are functioning quite well. That's one option. As aesthetics got more important, and silver and metal wasn't as pretty in our mouths, a filling has been made that matches our teeth to the exact color, which is nice. At some points, when a tooth breaks down so much that it's no longer strong enough to function, and a filling won't be adequate enough for that to hold the tooth together, we have to put a whole encapsulation around the tooth, a crown over it that will hold the whole thing together and allow that tooth to function and hold that space available. If it gets really bad and starts getting infected, then we have to talk about maybe getting a root canal. And if it gets really bad, unfortunately, sometimes they have to go away. The tooth has to go away and be replaced by something artificial. So ultimately, the bacterial progression through the tooth is what dictates this whole treatment scenario. There are three layers of the tooth. There's the enamel that we've talked about, the acid attacking. There's an inner layer that houses most of the tooth, just below the enamel. And there's a very center layer called the pulp of the tooth that houses all of the nerves and the blood vessels that bring nutrients and moisture and life to the tooth. Once the enamel is broken down, something has to be done. As the bacteria and the decay gets into the middle portion of the tooth, that process happens very quick to destroy that part of the tooth. And so ideally, we want to get into that tooth and get that eliminated early on by doing the filling or the crown. But once that decay process gets to the middle portion of the tooth, the pulp, where the nerves, the blood vessels are, that's when things go south. That bacteria, through that decayed portion of the tooth, that bacteria gets down to the nerves, gets down to the blood vessels, and creates an infection in the tooth, ultimately. That's what causes our pain and swelling and all of the bad things associated with a large cavity, the toothaches.
How do we prevent cavities from happening?
Well, like I said, our body tries to do it ourselves with the production of saliva to try to counteract the lowering of the pH, the acidity on the tooth. But our bodies can't always do it, obviously. That's why we need help. So that's why we have toothpaste. That's why we have floss. That's why we have mouthwash. Since I see kids, I start with children at a very young age and try to introduce great habits to children as early as possible. I see kids in my office for as young as 6 months. At that point, I'm more educating their moms on how to take care of their children's teeth, such as when to start brushing, when to start flossing, when to cut back on the sugar intake, when to give them candy, when not to give them candy. And so, for instance, a 6-month visit, we'll talk about trying to stop access to a bottle at night, a baby bottle with milk at night, because the sugars in that milk sitting on their teeth all night can really quickly destroy those teeth and create severe problems for them at such a young age already. So we'll start then and talk about cutting that back, brushing morning and night, at least twice a day, trying to instill good habits in them from the start. Flossing every night, because our toothbrushes, they can't clean in between our teeth. The only thing that can do that is with flossing, and if we leave that uncleansed, then that's another area where we can easily get cavities with the plaque staying there, housing the bacteria, creating the acid, breaking down the enamel. So we have great toothpastes these days that have a lot of fluoride in them, which helps to strengthen our teeth. We have fluoride in our water in general. We're going to come back and talk a lot about fluoride, because that one ingredient really helps to strengthen our teeth chemically and counteract any kind of bad process that might be going on. Fluoride in our water, fluoride in our toothpaste. Occasionally I'll prescribe a stronger fluoride even to try to undo that bad pH balance. My education that I provide to parents and then ultimately kids, we always talk about the access to sugar, the access to sugary products, and the frequency that they are drinking them or eating them. I tell them, I don't mind I love a child having a glass of milk. I like them to have a nice natural fruit juice. But having a glass of fruit juice, having a glass of milk in a couple minute time span is okay. Having that same glass of milk over a 2-hour time span is bad. Does that make sense? It's because the sugar in that substance is constantly attacking the tooth, interacting with that bacteria, creating the acid, lowering the pH in our mouth, affecting the enamel constantly over that couple of hours, or maybe all day if they're doing that constantly throughout the day. So we'll always have that discussion. And obviously, I always recommend frequent visits to the dentist so that we can catch problems early, or, like I said, try to prevent them before they happen. We'll do regular cleanings in the office to get all of the plaque off of their teeth so that they're starting with a fresh, clean tooth, and then provide some very strong fluoride to the teeth, which will ultimately soak into the teeth and even help make it stronger and help the enamel fight off that acid attack a lot easier. And we'll do something called a sealant, which covers over the top portion of a tooth, which is the most common place for us to all really get our first cavities, so that the tooth is a little bit stronger, the tooth is a little smoother, and much less likely to trap food in the tooth, trap bacteria in the tooth, trap sugar in the tooth, create acid, cause a cavity. So that really helps as well, and we try to do that at a very young age as possible.
So how does our oral health affect our overall body health?
That's a good question. We think of our mouths as the entrance to the rest of our body, basically. It's where we get our food and drink and sustenance, and those are the good things. The bad things that go in our mouth also get into the rest of our body. So the bad bacteria that we've talked about, that we have in our mouths, they don't exist in the rest of our body naturally, but they get there and they can cause some issues. There's a severe link with cardiovascular problems. Heart defects can be worsened, and actually heart infections can be caused by that bad bacteria from the mouth getting down to the heart. There's a negative correlation between diabetes and gum disease, and those two together can worsen each other. The gum disease can worsen the diabetes can worsen the gum disease, and so there's that. Our mouths, a lot of people feel like they're separate from the rest of our body, but they can really affect our whole system. If we just looked at our mouths, though, and we talked about maybe a tooth got infected, the nerve got diseased, got taken over by the bacteria, and an infection started. That infection may just live in the tooth for a little bit, but ultimately, once that infection grows and grows and grows, it's going to work its way out of the tooth, into the bone around the tooth, out of the bone of the tooth, into our gums, and ultimately maybe into our cheek. And if it's not into our cheek, what's the next closest thing? Our brain. And so a toothache can maybe start as just the smallest thing, but create such a bad problem.
You mentioned gum disease. Can you expand on that process?
Certainly. We've been talking a lot about the decay process, but gum disease is another serious issue. So oddly enough, enamel around our teeth is one of the hardest substances, is the hardest substance in our mouth. The gum tissue right around the enamel of the tooth is one of the softest and one of the most delicate. So gum disease is a very progressive disease. Like I said, our gums are very delicate, and the tiniest change in the surroundings of our gums can create some damage to our gums, let's say. For instance, one goes without brushing their teeth for a few days. Plaque builds up around the teeth, and the plaque really irritates the gums. It'll make them red, it'll make them puffy, it'll make them bleed to the touch or when you brush them. As that goes on, if you continue to not brush, or even just continue not to floss, like we said, that if you don't floss, it leaves that area of the tooth full of plaque, and that's going to irritate the gums as well. At that early stage, that's just called gingivitis, and that can be corrected by simply brushing, flossing, having a normal cleaning. If that's left untreated, then that progresses further, and the plaque around our teeth, if that is left on there, eventually interacts with minerals in our saliva that will make that plaque harden on our teeth and eventually grow on top of itself. The calculus ends up being pretty rough, a rough surface, which again will irritate that very delicate soft tissue of our gums. And as that happens, the gums will self-protect and recede away from that. As the gums recede away from that, the bone underneath that then in turn recedes as well from the calculus, which, like I said, is not only rough, but also full of bacteria. As the gums and the bone around the teeth recede down, that leaves less support for the tooth. The bone is ultimately what's holding our teeth into our jaw. And as that bone decreases in height around the edge of the tooth, then there becomes, like I said, less and less to hold the tooth in, and the tooth can eventually become loose in our mouth. And a otherwise healthy tooth in the presence of gum disease, in the presence of periodontal disease, can be lost even if it doesn't have a cavity.
So is gum disease treatable?
It's treatable, however, it's not reversible. Once you've lost bone and gum tissue from around your teeth, we really can't grow it back. But we can stop the progression. A periodontist, a periodontal surgeon, is often needed to be consulted and involved in this. A lot of times it can necessitate a surgical procedure to reshape the bone and gums around the tooth. Like I said, it's not reversible, but at least they can go in there, maybe give some antibiotics around the tooth, get rid of as much of that bacteria that's in the tissues even, and just stop it from getting any worse.
So you mentioned antibiotics. How often do you utilize antibiotics?
Pretty regularly. The thing about antibiotics in my field, I mentioned them about the periodontist using them to try to eliminate some of the bacteria. In my area, Antibiotics are used mostly just to try to prevent that bacteria that's in our mouth from spreading on, or that infection that might be in our mouth from spreading to other parts of our body. Normally I'll have to do some sort of procedure to eliminate the infection other than the antibiotics. It just the antibiotics just prevent it from getting worse. And we have a multitude of antibiotics that target different sorts of infections throughout the mouth.
We talked a lot about how bacteria affects the mouth. How do viruses affect the mouth?
Viruses don't affect the mouth quite as much as bacteria, but definitely can have an effect. Some of us have viruses already in our system that we obtained that are triggered by certain things to cause oral implications. For instance, stress can trigger this virus, and maybe we'll see mouth sores, maybe we'll see a little fever blister on the lip, things like that. And so we deal with that a little bit. Not quite as much in my practice, but unfortunately with something viral, there's not really a cure for that. There's not anything that we can really prescribe to heal the problem. It's just we do more of trying to ease pain or speed up, something that might speed up recovery a little bit. But as with most viruses, it just has to run its course.
So did you know how much biology you were going to use in your career today?
I would say when I was, 12, saying that I wanted to be a dentist, I probably had no clue how much biology I was going to need to know and need to use and make decisions based upon. So no, but it's surprising. It became surprising to me as I got more schooling, especially in dental school, about how much was involved, biology, microbiology, chemistry, everything like that. That I obviously need to know on a daily basis and make decisions upon. And as I said, educate both parents and patients about, because that's a daily talk that we have to have in our offices, is how the biology affects our mouth.
So if we wanted to come to your practice, where do we find you?
Hey, that'd be great. I'm in Dallas, Texas. My office is called Tooth Doctor for Kids.